Hello everyone. So today's topic is necrosis. Necrosis means morphological changes after cell death. Subtypes are coagulative. So most common subtype of necrosis. Most common cause is ischemia and coagulative necrosis happen because of denaturation or inactivation of hydrolytic enzymes. So it is associated with tombstone appearance means the structural outline is preserved and can be seen in all organs except CNS. So, coagulative necrosis is seen in all organs except CNS. Now, in fact, localized area formed due to ischemia, usually triangular in shape. Apex of the infarct points in the direction of site of obstruction. Subtypes of infarct are white infarct and the red infarct. So, white infarct seen associated with organs with end arterial blood supply, particularly in solid organs, example heart, kidneys. Second is red infarct, seen in organs with loose connective tissue. Seen in organs with dual blood supply like lungs or liver में red infarct, and in heart or kidneys we are having white infarct. So this is the diagram of infarct. This is site of obstruction, and this is apex of the infarct base. Now, the Zenker's degeneration, which means coagulative necrosis in skeletal muscle associated with typhoid, commonly associated with neutrophilic infiltrations for clearing dead cells. Now, liquefactive or colliquative necrosis, not coagulative. So, second subtype of necrosis is liquefactive colliquative necrosis. Here, the dissolution of dead tissue and transformation into a liquid viscous mass, the hydrolytic enzymes activation, damage to tissue structure. Examples are CNS ischemia, damage of glial cells leading to hydrolytic enzymes present abundantly in glial cells activation. Infections associated with pus formation is associated with Staphylococcus aureus infections. Third subtype is caseous necrosis, cheese-like necrotic material, coagulative necrosis plus liquefactive necrosis. And in this, the coagulative necrosis is predominant, seen in TB, fungal infections, histoplasmosis, coccidiomycosis, which is valley fever, and syphilis. Non-neutrophilic granulomatous reaction present, monocytes and lymphocytes infiltration seen. Langerhans cells are associated with tubercular focus. So, Langerhans cell are associated with tubercular focus. Fourth subtype is the fat necrosis, seen in organs with high fats or lipase activation, and seen in injury to breast tissue, injury to omentum tissue, which is policeman of abdomen, pancreatitis. So, fat necrosis is seen in injury to breast tissue, injury to omentum tissue, and pancreatitis. Now, example is acute pancreatitis. Now, pathophysiology, gallstone or alcohol leads to the lipase activation. Then the lipids in presence of lipase get converted into fatty acids, and fatty acids plus calcium, which is serum calcium level decreased, is the important prognostic factor to assess severity of pancreatitis. Now, fatty acids and calcium, they will do the saponification, chalk like yellow white deposits, and in pancreatitis there is involvement of two types of necrosis. Pancreas liquefactive necrosis is seen, and in peripancreatic fat necrosis is seen. Now, the fibrinoid necrosis, it's a type 3 hypersensitivity reaction. So in this there is endothelial cell injury. Because of that, there is immune complex formation and damage to plasma protein in the vessel wall. Inside the vessel wall, deposition of plasma protein seen as pinkish appearance in vessels. And the person suffers from fibrinoid necrosis. Seen in malignant hypertension, Ashkoff body, immune complex disorder, or type 3 hypersensitivity reaction. And next is gangrene. Gangrene is of three types: dry gangrene, wet gangrene, and gas gangrene. Now, dry gangrene, ischemia, decreased blood supply plus coagulative necrosis. Wet gangrene is ischemia plus secondary infections, liquefactive necrosis. And gas gangrene, subtypes of wet gangrene associated with Clostridium welchi, very important. Clostridium welchi produces gas in the subcutaneous tissue.